Hello from CES 2019. We are excited to have Mr. Jacobs from Philips, from the Netherlands, and he's going to tell us about the latest developments at Philips company as it relates to their efforts in health, in medicine, and in personal health and lifestyle as well. So what's the latest?
Thank you. Yeah, we're very excited to be at CES, of course known as the Technology Show. And what we are showcasing is how our technology and innovations improve people's lives, especially focused on personal health. So what you see, for example, behind us is Pregnancy Plus. It's a platform that we launch in which we accompany parents in their first 1,000 days of pregnancy to answer any question that they might have, to give great visualization of how their fetus will develop, and also to link to a broader ecosystem where they, of course, can also purchase our products from Avent or actually hook up to services. Another area is in Philips Sonicare, where we traditionally have been very active in oral healthcare. We're expanding from adding technology to a smart toothbrush that actually can monitor where and how you brush, and actually as such sees how your adherence is, but also where potentially problems start to populate. And actually we're launching a teledentistry service where within 24 hours you can get an advice on any teething problem you might have and occur during your oral healthcare routines. We have a big launch in sleep domain, where we see that the sleep area in the consumer space is really picking up a lot of interest. We know that there are many different types of sleep challenges that people face. Some are more severe, like sleep apnea, which we have been very active in for years, also on the hospital side and the professional side, and we're now making it into more consumer solutions. Last year we launched our sleep band, which actually helps you to get more out of your sleep by actually getting you into deeper sleep. This year we are also launching a snoring device. 40% of men snores, 24% of women snores, and actually we have a device which actually you put around your body and gives you a small pulse at the moment that it detects snoring. So you move your body, and by moving your body actually the snoring goes. So it's a very practical replacement of your partner pushing you or putting and having technology actually identifying that need. We also have a smart sleep analyzer where actually we do a lot of analysis around your sleep patterns, and based upon our millions of sleep nights that we get through our professional side, actually we can triage it into clinically validated recommendations how you can improve your sleep. So those are areas in sleep that we are working on. And then there's an area of nutrition, where nutrition of course also is very critical for health improvement, where we're showcasing some of our solutions to actually help you provide and prepare healthy nutrition, but also look at the ecosystem around it. What is an app that can actually give you advice in recipes, but also have partnerships with other players like fresh food delivery or recipe delivery to you. So what you see is that Philips is evolving from product into a much more solutions company, where in the personal health arena we are building on the clinical medical knowledge we have also from medical background and really making it a use for the consumer. So it's about the technology that enables that, and can be adaptive intelligence, it can be sensoring, it can be traditional technology in product development, but all of that we want to make and put at work for consumers' health.
So it's products and services as well.
Yes, so what you see us evolving into, and that's actually you see in every part, you see it in modern childcare. Traditionally we have been very big in our event product business. We're now adding services like a platform that actually can answer a lot of questions. We're looking at coaching in sleep, we're looking at coaching in nutrition, and we're even looking at coaching in skincare.
Very interesting. All right, thank you very much.
Welcome, enjoy your show.
Thank you. We will check out your devices and we'll profile them as well. And I have another interview coming up with Philips, with Dr. White, who is going to talk about your sleep, the sleep band, and it's very interesting technology. It's actually very clinically validated, and it's very interesting neurostimulation technology.
What you see happening, I think, and CES is a good example of it. You see in the years of CES, consumer health growing extensively in kind of exposure and interest.
Right, and into health and lifestyle.
And health and lifestyle. And technology kind of course, is based upon individual data of consumers and of people. We want to give personalized advice. Many others do want to do that as well. I think where we really do differentiate is that we want to do it clinically validated. So that's indeed why you're talking to a doctor in sleep, because we have many doctors that actually are active, and we have many clinically validated studies. The same we do with oral healthcare, where we are the most recommended toothbrush because of its clinically validated, what the effect is of our Sonicare motion.
Right.
The same we have in skincare, where we look at clinically validated data, and the same we also have in Pregnancy Plus, where we look at kind of how can we support based upon understanding also the broader needs in the pregnancy space. We are also active in NICU in the hospital. We are also
with ventilators.
So there's a logical bridge where actually we can extend the service and actually capture the knowledge and transfer that back from consumer, but also from consumer into hospital.
Right, from clinical, both ways.
Both ways, and we see also a big trend coming where we see actually health is consumerizing, so consumers taking much more interest in their health, but also we see the healthcare system taking much more interest in actually getting into the home setting. So the home setting is becoming more important to provide care. So you also see another part of our booth where it's about aging and caregiving, where we also have and are launching a platform that connects people in need of care and actually watching over with Lifeline. We have now a connection to 2,500 hospitals within a platform that can actually have physical interventions if they are needed. So you have a second helpline next to your virtual helpline that comes into play to really extend and manifest your care proposition.
How do you find the regulatory environment, FDA versus European clearances? Do you have any? It seems like Europe is always, 2 steps ahead of, American FDA approvals.
Now, of course, we work extensively across the globe with all regulatory approvers. I think it depends a bit on the topic.
Right.
I think FDA is also very stringent and very forward-looking. I think if you look especially in the area of data privacy, then European is even more stringent.
Right.
And that's something we need to take care of.
Right.
And of course, we always comply. But it's also finding a right way, because some of the individual data from a population health perspective can be very interested, of course, to be combined and
analyzed on a large scale.
Exactly, because we are building the algorithms based upon huge amounts of data that we can collect out of hospital, out of consumers, and actually make it work for better health outcomes. But it is a very critically important theme for us. Regulatory requirements are going up, and rightly so. Actually, it also helps us to differentiate because we do comply, and we also will make clinically validated outcomes always support our propositions. But it does mean that you need to have different regulatory systems that you support. The only wish I could have is that they would be more united, because of course it does not make sense to have all different type of levels of requirements in different countries. Ideally, you have a standard that you can adhere to more globally.
Right.
That would take a lot of cost and out of the way and increase speed, in which we can actually then turn health delivery into work for us.
Thank you very much.
Welcome.